I love CureMD. It's the best thing since sliced bread, I will say.
My passion is the hospital, but my calling is kind of the clinic.
If anybody's in your corner, that is me.
Hi everyone, I'm Ken, Director of Product at CureMD. Welcome to the podcast. Today we're going to be joined by Lateasha Lunceford, Director of Atlanta Internal Medicine and Psychiatric Care. And later on, Dr. Gregory Lunceford will also be joining us. All right, so maybe a little bit more background. How did you're from Texas? That's
Yes,
hometown?
I'm from Texas, Killeen, Fort Hood area. Have you ever heard of it?
Yeah.
I grew up in a diverse area. It's very heavy based in Army. It's the largest Army base out there in the United States. So I grew up in a diverse background and military town, and kind of led me to join the military myself in the Air Force.
Yeah, but that's where the structure and the organization and all of that comes from, right? Yeah.
Yes.
So very cool. How do you like being a practice administrator? I mean, I know it's one part of the many things that you do, but do you enjoy it?
I love it. Actually, I do. With my background being a pharmacy tech, I also worked in medical administration. I did a little bit of medical billing when I worked at Woodford Hall for the Department of Air Force. And I really love the interaction with the employees and the patients. So, every little bit counts, everything that you do. Anytime I can make a fun and organized environment for the employees, it's great for the staff. It's great for the staff. And it's also great for the patients. So I love it because it's like I get to pour back into my people. I'm very silly. I like structure, but I'm very fun and free. And so,
yes,
I'm all about working hard. Yeah, working hard and playing hard.
Got it. Okay. And then you guys were using another system a while back, right, before CureMD. So do you want to talk a little bit about that?
Yes, we were using it. Okay. And when I met Gregory in the beginning, I came in and I started helping him in the practice, and I was like, what the heck? I've used better EHR systems, way better than this. And I was like, this is very complicated. They had one side was for medical records and for clinical, and the other side was just kind of administrative. And I was like, why don't we just have one side? We got to log into two different sides. And in order for me to get training, I was so confused. It was very hard when I would call the customer service to get assistance. I would always get kind of railroaded and, all the way around. And then if I wanted more training, everything costs. Every little thing costs.
Yeah.
And so it was so difficult to get training. And I mean, and the cost was astronomical just to get training.
Wow. Okay. And I hope the experience with CureMD has been markedly different.
Oh, yes, remarkably different. I love CureMD. It's the best thing since sliced bread, I will say.
Oh, wow. Amazing. And then you guys use Leap too, right, with patients?
Yes, we do use Leap. More so the admin staff and the nurse practitioners, they use Leap a lot. I'm just kind of the overseer right now, but I have had no complaints.
Wow. Okay. That is amazing. Do you guys do telemedicine as well? Is that something that you're already doing in the practice or incorporating into the practice?
We are currently doing telemedicine now, and in psychiatry, it's such a huge thing. And I think it's just a huge thing that a lot of people are using. And I think that is because people are more comfortable in their home, especially when talking about something very personal in psychiatry and about their mental health. And so I would say 75% to 80% we use telemedicine.
Wow. Okay. And then you're a multi-specialty, right? You're internal medicine, you're also psychiatry. So how did you sort of decide to bring both of those things in the same practice?
Well, my husband is, and so he double majored, and he went to school for the internal medicine and psychiatry. And he said that it was more so the need for psychiatry. But luckily he has a lot of background in internal medicine, so it does come in. We more so focus on psychiatry, but when needed, he will administer his knowledge of internal medicine.
Okay. Okay. And the practice is growing. I saw from last year, right? It's constantly getting larger and larger. So what are your plans for the practice? I mean, where do you see yourselves going with the clinic?
I want to continue to expand and get more nurse practitioners, maybe getting another psychiatrist. And, hopefully my plan, I have my own plans within the practice, is coming up with a system that works. And also hopefully coming up with a system that works. And of course, with using CureMD, applying some type of AI into our administering that into our systems. And I would like to create a program where I can kind of present it to other practices. Like, hey, once I set this up, the system works. I'm very big on keeping the system honest. I mean, that was very important in the Air Force. We always had structure. We always had a system. And once I showed that the system, it works, I want to be able to present this to other practices and, and then, spread the gospel.
Yeah, your word. Yeah, absolutely, absolutely. So, I mean, some of maybe the toughest question, right? A husband and wife working in the same clinic. How do you guys make it work? How do you guys get the energy? How do you guys solve problems? What's your secret?
My secret is delegate and organize. Delegate and organize. And I'm trying to get Dr. Lunsford on board with that. No marriage is perfect and no practice is perfect, but I will say that we are still creating our system. Gregory, he tries to do the clinical piece, and I kind of do the background work, the administrative, to make sure, copays are being collected, billing is fine. One thing in our marriage, I told Gregory that he has to trust me, trust that I'm his partner, that I know what's best for him. I know what's best for the practice with my background. And also, like, me being a wife, I care. As women, we are more detail oriented. So I tell him all the time, like, if anybody's in your corner, that is me.
No, I get it. And physicians are not always the most entrepreneurial or business savvy, right? And they don't have time to always look at the little things. But yeah, you have to be able to trust your partner. So that's amazing. I think it's such a big blessing that you are there for him, and you can enable him to give people the best care that he can. Yeah, so that is great partnership. And Dr. Lunsford, you just got back from the hospital, so what's a day in the life of a physician, right? A busy one such as yourselves. Maybe we start there.
Oh yeah, I mean, the day in the life of a physician is action packed. There's never a dull moment. That's for sure.
Yeah. So, I mean, do you want to maybe talk a little bit about your background, right, and how you came to open up your own clinic and this wonderful sort of, internal medicine psychiatric clinic that you guys have going right now?
Sure. Well, I mean, ever since I was a kid, I wanted to be a physician. I think I caught the bug from my dad. He wanted to be a physician, but when he got back from the service, he didn't have it in him anymore. So he just kind of, I guess, planted the seed in me. And, I always did like science and math, always, did well in those subjects. And so, I matriculated through. And then when I got to medical school, I really started to then ask myself the realistic question as to why I wanted to be a physician. Because it was a weird day. It was like I stepped off the elevator for my first round of rotations, and I looked around like, why am I really doing all this? And I really didn't know at first why I really wanted to do it, because I had bounced around a little bit. I did some research and different things in undergrad, and so I found that there was power in knowledge. And so, I sort of liked the idea of being able to say something and nobody being knowledgeable about something, and then it puts people on, guard. And so I kind of like the power that provided. And so, I kind of let my ego soar a little bit and rode on that for a little while until that got boring. But then, then I started to really get into people. I really like people, and then seeing them in a vulnerable situation where I can help, became very appealing. And so by the time I got done with medical school, I really wasn't sure what I wanted to do. I knew that initially I knew that I wanted to be a cardiologist, so I was doing internal medicine, but I was like, it's not getting everything that I needed to get. And I've done all that research. And anyway, so I decided, well, I like psychiatry a lot. And I like psychiatry because of the educational aspects. I felt like a lot of times if you would just try to explain to people what their conditions were and what to expect from those conditions, it would really help relieve a lot of tension, not only for the patient, but everybody involved in the patient. So I got like that. So I was like, I finished my medical school and I applied to residency at Duke. And, I pursued the psychiatry program, and then I found that they had a med psych program that they had just developed. It was the second year that they had the program. And so I transitioned to that. And then I landed on Atlanta after I finished that program. And, I was recruited here to do a med psych program. And, just the way medicine as a field evolves and what is profitable and what's not for a hospital system. So the med psych program didn't completely materialize. And so I found myself doing internal medicine and some hospital work. And the psychiatry thing just blossomed out of nowhere. Because before I got my license here in Atlanta, I worked at the state hospital doing adolescent psychiatry, excuse me. And I wasn't sure if I wanted to stay and do that because I really enjoyed that a bit. I almost didn't come. I almost turned my back on Atlanta, but I came and I started doing some clinic work to sort of continue seeing adolescent males because that was important to me. And then years started to fly by and I just get pushed into where I'm at right now. So,
but you're in an amazing place because you guys have a clinic, you guys are working on it together. We were chatting with Lateasha about that earlier. But how does that work, right? How do you make it work? Because she's the power, she's the administrator, she's the organizer. But how does that relationship work in the clinic setting, right? How does that make you successful?
Well, I'll be honest. I mean, I really need her help. She's been just vital and turning the corner with the clinic because, my passion is the hospital, but my calling is kind of the clinic. Does that make any sense? It's like most of the people in the clinic have come from various other places I've been for a while, and they've, and so the clinic got started, and I just really needed somebody to come in and help me with organizing things and helping me with, getting to the post-COVID era of managing a practice, which is just completely different. There's so many more moving parts now, a lot more moving parts. And so, she's been very vital with that part of things.
So I mean, if you have, and there's going to be other people, so many people look at you, look up to you, see you as a celebrity, see you as a physician. And so what advice would you give them, right? If they were setting up their practice, if they were looking for systems, how would you advise them to go about it?
I would tell them to get someone to help you who is knowledgeable about technology and the advances in being efficient. AI technology is vital. And, just learning how to negotiate what's going to be a problem for you day to day, and you'd be surprised that, what little things can turn into big things if you don't have somebody who is more knowledgeable about how to work through processes these days.
Yeah, absolutely. So, I mean, I think this is something that's coming up everywhere, like AI scribes and, AI assistants in technology. But you're up for that? You're looking forward to having those tools available to you?
I am, as long as there's not like overlap. because right now my challenge is trying to find programs that don't cause me to duplicate any work, and so that's my issue.
Okay. And then we wanted to talk about Michael since, he was able to tell us so much about you guys and you guys have regular meetings. So how has that relationship been with Michael as a billing specialist for you, as somebody assisting you on the billing side?
It's vital because I don't have the time, and there's always this paranoia that what's happening with the money?
Yeah, absolutely.
With corrections and I wish I had somebody who could watch out for things, and so it's very
Yeah, Michael goes above and beyond. I really appreciate that. And, Michael really works with his schedule. I understand that he's busy. And so he works very closely with our office manager, Sean, and he knows that he can give me a call. And so I love the fact that he goes over and beyond, especially working with Dr. Lunsford's schedule.
Okay. Well, it's been a pleasure talking to you guys. I think that's most of the questions that I had. It was such a pleasure talking to you both. And we really appreciate you guys giving us the time. So I think, best of luck to you. We're with you in this together. And I think we're going to be great for each other.
Thank you.
Thank you. I look forward to the future with us.
All right. Thank you both. Thank you so much. And that's it for today. If you are a provider establishing your own practice, and if you're looking for EHR and RCM solutions, I hope you found this valuable. Have a great day.